Good morning. Welcome to our Mom Minute. I'm Elizabeth Lowder.
I'm Martino-Sexton.
And we're with Heartland PMAD Consultants. And this morning we're talking about moms and moods.
Yes, moms and moods.
For only a few minutes. I mean, because we could talk about it all day long.
That's right.
We got stuff to do though, and I'm sure you do too.
And we all have moods, right? And they vary all the time. And one of the things that comes up a lot in working with moms and myself as a mom is that somehow our moods could make us a bad mom. And what we want moms to know is that good moms, all moms, have moods. Of course we would, we're human beings. And so keep in mind that whether our mood is angry, whether our mood is excited, sad, sometimes we're just really frustrated. And all those moods are normal, typical, expected. And we deserve support as we move through all the different moods. Now, I feel like I'm not avoiding the topic, but I want to make sure behind me you can see the sign. It says Heartland PMAD. So we are going to talk about perinatal mood and anxiety disorders too, because those are some serious moods, right? So there's the ones that we kind of ebb and flow through every day, and then there's the moods that we may ebb and flow through them, but they feel really hard to get through. And those are the ones we want to make sure that moms know that we can have them, we're still good moms, and we deserve support around all of these moods.
Mm-hmm. What kind of moods were you guys talking about at your group?
And so in groups this week, we've talked about, what did we talk about? There was some sadness that we talked about, overwhelm we talked about, being angry, frustrated with lack of support. Those are some of the things that came up this week.
Mm-hmm.
So we kind of just dived in. I guess for those of you who may not know us, if you're joining us for the first time today. So I'm Kim, I'm a mom of two. My kids are almost all grown at this point, 24, 19 years old, two boys. And I have been, I'm comfortable saying, fascinated with this perinatal mood and anxiety disorder stuff since I experienced my first deep dive into depression after I had my first son. And then after I had my second, a few miscarriages in between, had my second son, and then an interesting experience, I'll say, with anxiety and very high levels of it. And so I've been really interested in how moms heal, how moms get through this, how moms get support since then. And so, Elizabeth.
So I am, by profession, a trauma therapist, and I've also had my own experiences with PMAD. I have two daughters, 13 and 8, and I had really difficult pregnancies and deliveries. They were both in the NICU. I was sick, really, really sick the entire pregnancy. And so I had, talk about moods, I had postpartum PTSD after both of my daughters were born because it was so traumatic. And so I had a lot of high irritation, low stress tolerance. It actually resulted in an adrenal cortisol issue for me after a while. And so that's one of the reasons why I wanted to start stage 3 therapy, which is my practice, where I work with moms that had all kinds of perinatal mood and anxiety disorders, all kinds of different birth trauma, pregnancy trauma, that can include infant loss, pregnancy loss, because as a trained trauma therapist, I realized how applicable the things that I was doing at work were to a whole population of moms that were not really being addressed. Like, as soon as my babies came, very, very few people checked on me,
Mm-hmm.
and you know, my babies needed attention, obviously. They needed medical attention, and they were fine. But that really hit close to home, that like, just because your baby's born doesn't mean, and just because your baby's born healthy doesn't mean that mom's okay. And we need to be checking on moms more often for a longer amount of time.
I think it's tricky, this checking on moms, because I look back and I remember as much as I felt alone and like no one was checking on me, even when people were checking on me, I was less likely to say that things were going well because of the fear of being seen as not good enough, the shame and guilt of admitting that maybe I couldn't handle this because, you know, I had this amazing career, I was doing all these amazing things, and I had this baby that then took me out at the knees, and that made it hard for me to admit. So we need to keep asking. I guess that's the point I'm making, is that
just assume that she's overwhelmed, and she can do the things that she can do, but maybe like give her choices. Maybe like check in with her and be like, hey, would it be helpful if I like ran some errands for you? Or would you rather me hold the baby if baby's crying a lot so you can take a shower? Or would you rather stay with baby and I can walk your dog?
Right? And I can do some laundry. I think that that's really key, Elizabeth, is that we offer moms choices. So it's not just, because I love this idea of ask her, but I think we also have to be prepared with choices. And so, you know, so that, you know, it's like, hey, how are you doing? I remember it being a struggle, and I remember wishing someone would just, you know, load my dishwasher for me. So what can I do for you? You know, would it be helpful if I loaded the dishwasher? And like Elizabeth said, run through a couple of choices. Because in that overwhelm, in that struggle, it's really hard to come up with, I don't know what you could do to help me. There's too much.
Yeah, because when you're the person that needs the support, it's hard to educate your support system on what you need. Which, you know, there are supports in place to help moms better identify what they need and maybe better communicate what they need and stuff, like, but that's just the fact of the matter. And as we talk about moods, you know, it was way, way, way more helpful, I found, for women in my life to say, like, oh, I didn't ever have a NICU baby, but I remember just being so tired. Are you really, how are you feeling? Or, you know, maybe they didn't have the exact same birth experiences, and that's okay, but they would say, like, how are you doing? You know, like, oh yeah, baby's cute, but how are you doing?
How are you?
You know, and that felt really meaningful. Like, I felt seen and heard, and if you know, just some simple, like, empathic statements like that helped me know that they were safe to talk to. If I ever needed to, that maybe they would be safe, because they didn't seem like perfect, unflappable moms.
And that's a really good point, right? Having people who it's safe to say these things to. And I, you know, I'm as we look at a couple people who are joining us, I'm thinking, boy, talk about a safe space. Hello, Jerry Michael. So happy to have you with us. And Gina is stepped in today, and Stephanie. And so making ourselves that safe space, letting people know that we had some vulnerability too, because you're right, we don't have to have had the same experience, but if women know that, oh, okay, so it's okay to let people know this is hard, that there's a struggle, and even if the struggle is slightly different, there's still struggle, and this person is willing to be vulnerable with me for a minute, sharing that they experience some, so then it might feel safe for her to share with us. And so, you know, I'm always in awe of the courage of the women who reach out to get support, because I remember how hard it was for me to reach out, and I reached out several times to people that I thought would be safe, and that's not where I found the support. It came in more surprising places, and today it's not surprising to me because it came in the form that support and that safe space was other moms. I was trying to get support from professionals and not being heard. And so part of the passion for Elizabeth and I, the work that we do with the professionals who work in this area, is to encourage them and assist them as they open themselves up and establish that safe space for moms. And so we're excited to talk about, one of the things we are going to talk about today is our training conference that's coming up November 6th and 7th, where we're training around perinatal mood and anxiety disorders with our Heartland protocol that we've established that helps providers step into that and establish themselves as a safe space.
Mm-hmm. That's a good way of putting it.
Yeah, I mean, we're really, that's what we're up to. We know providers mean well. We know that they have amazing intentions. I always say about OBs that OBs did not go into some people like, oh, doctors just want to be doctors to make money. And maybe there are doctors out there that do that. But what I see are doctors who have just this amazing passion for supporting women, caring for women. When I look at OBs and what they do and their schedules, I mean, who signs up to work 24/7, 7 days a week, and then on top of it run a daytime practice?
Yeah.
So these folks have this incredible passion. And pediatricians, again, another really passionate group of folks. Nursing staffs, oh my gosh, the folks who really care for us in times when we're so vulnerable, and they make it safe for us. And so those are the folks that we're working with. Those are the folks that we're helping to step into even different levels of that safe space, because everyone is trained in their disciplines. We look at OBs, pediatricians, nursing staffs, phenomenal in their specific discipline. And then we bring in mental health. Dun, dun, dun. And that's where a lot of people get stopped. And Elizabeth and I want to make it easier for providers who don't, unlike Elizabeth, who is steeped in mental health training. That's her thing, right? But for doctors and nurses, that's not necessarily their thing. So it can be something that is a little uncomfortable to talk about.
And it doesn't need to be their thing. It doesn't need to be their specialty, but we want, I think, a lot of very competent, really good, caring OBs and nurses and pediatricians are even selling themselves short by making, if we're lucky, they're making a referral to a mental health provider, which is great. But Kim and I have developed like a 5-step protocol that is very easy to incorporate into the visits that you would have with your doctor, that kind of help bridge the gap between just making a referral and being a full-time legitimate therapist and having a therapy session. The Heartland protocol can kind of get you closer to also having your patient, if your OB was to just give you a referral, like, oh, you're not doing so hot, you need to go talk to Elizabeth. You may or may not feel very seen, heard, validated. Like, I don't know how you guys would respond to your doctor doing that, even if you knew you needed it and wanted it,
right?
Versus your physician hitting a few major points before making that referral. What we know is that women are more likely to call and make that appointment, to go to the appointment, to come back to OB and tell them how they're doing. Like, it just encourages more wraparound, comprehensive care for moms. And like we always say, if mom's okay, everyone's going to be okay. If mom's okay, baby's going to be okay. If mom's okay, family will be fine.
Right.
So we got to get mom okay. So, sometimes when I talk about these things, I wonder, I know the experiences that I hear my clients have had with feeling like they have champions in their OB office that helped connect them to Sage Tree. I also hear some other stories that aren't so, don't warm your heart, that really are disappointing. And so we're all allowed to talk about those experiences, and we want to do whatever we can to help support moms feel more, have more permission to talk about what's going on, even if it's with their doctor, even if it's with, you know, the nurse that's checking at the pediatrician's office to say, like, I'm not doing so hot, and you know, what do I need to do? So that's kind of where we're focusing our efforts, is trying to get that message out. So we'd love to hear what you guys think about that, and what we need to be, what in your experience we need to be focusing on, or making sure that we're spreading a message that's representative of your experience with having, you know, having any kind of mood or anxiety.
Yeah, there's so many things that pop up for me as we're having this discussion, and as I think about, I'm so grateful to get to talk to doctors and nurses and social workers and all kinds of folks who are learning to work with moms in a different way, who are coming into this, and because I get to sit in spaces with moms as a peer facilitator, and I get to hear what's happening, providers are interested, like, well, what are you learning? What can we do differently? And, you know, just the desire to want to do something differently is huge. You know, if you think about, when I think about doctors' offices that I've gone into, and the frontline staff has so much opportunity to make us feel safe and welcome, and that's, I think, part of their job. I mean, there's an element of customer service, right?
And that's a lot of the reason why people stay at doctors' offices.
Right, is that frontline staff. There's a rapport that's established with the folks who are checking you in. And, you know, and we just want to, you know, shout out to those amazing folks who, you know, they step out of whatever pain and whatever stuff is happening in their daily life, they show up, and then they create that safe, welcoming space for moms who are coming into the OB office, to the pediatrician office, to a psychiatrist's office, to wherever they're coming into, you know, and those folks that welcome us. And that's part of what we talk about, is that, you know, we know that these providers and the frontline staff that help, you know, keep the business going, the day-to-day everything, I mean, these folks are human too. So, you know, they too, like on my way here, they too sat in some traffic, got cut off by someone who wasn't using their signal. They, you know, and then they shook it off at the door, and they showed up being present for the moms.
Yeah, and I think being present is the thing that folks that are good at building rapport with patients, with moms, with just people in general, is because they can be present right in the here and now. You know, like, not worried about what didn't go well yesterday, not worried about, you know, all the stuff they have to do today, but just like checking in with moms.
And, you know, I looked at some of the doctors who I've had the longest standing relationships, like my personal physicians, the folks that are, you know, part of my wellness team, whether that be, you know, from chiropractors to dermatologists to OBs to primary care. It's those folks that when I'm with them for the 7 to 10 to 12 minutes that I get to be with them, that they feel to me like they're right there with me. I don't feel the sense of, oh, they're going to see 15 other patients today.
Yeah, they give you as much time as you need.
Right. It feels like I could be there forever, and then you still walk out. It's like, oh, well, that was the normal 15 minutes with my dermatologist who, you know, but he attended to me. He was right there with me. And it made me feel safe, and I could talk about, because who wants to talk about dermatological stuff other than dermatologists? I don't. This is not my favorite place to be. But they make it a safe space. And it happened from the moment I walked in the door. And so that's part of what we're talking about is we all have to have a level of self-care. So our providers have to have a level of self-care so they can show up and be who they need to be for their patients, you know, for us, for me as a patient. And so we're talking about not only moms needing self-care and getting the care they need, but our providers getting the care that they need so they can be who they need to be for us, right? So it's everyone, because we're all human beings. No one's checked out at a different level here, and it's like, oh, I'm above this, I don't need self-care. I'm above this, I don't need to show up.
Yeah, and the fact of the matter is that most of the care providers we're talking about that we love and have a really good relationship with are working moms. So it all comes down to like, if mom's okay, everyone's going to be okay.
Right.
Like everyone they come in contact with that day is going to be doing better too.
Right. Because we're all going to have moods. So, we circle back to this idea of moods today. Like, we're all going to be, and I'm going to talk about moms because that's my experience. So as a mom, as my children have grown and they're 24 and 19 now, and I can take a look back at, oh my gosh, the space I was holding for my kids to have their moods, and then to get my mood settled so I could do what I needed to do. And then for any of you who have children who are in school, when you pick them up after school, you never really know what you're going to get. You know what I mean? Like
a talkative kid, a kid
right.
that won't,
the sad kid, the frustrated, the I just want to scream and yell the whole way home kid. Like, you don't know what you're going to get. Yeah. And sometimes that varies day to day, but as moms, we hold this space. And how wonderful it is to feel when I got to be in moms groups and in different places with professionals who held a space for me so that I could have the moods I needed to have and talk about them. And so, one thing that sticks with me is one of the moms I talked to over the last couple of weeks said, this is just not me. I am not a person who talks about negative stuff. I'm positive. I've always been optimistic. And so part of me doesn't even want to sit here and talk about all the negative things I've been experiencing.
Because it feels icky and uncomfortable.
Exactly. And I don't want to be that person. That's not me. And so part of this mood thing that occurs too is all of a sudden we don't feel like ourselves anymore. That is not me. I mean, it felt like there were multiple me's. Like, I don't have a multiple personality disorder. However, like, I didn't recognize who I was.
Yeah, like your baseline feels different.
Yeah.
Does that make sense? Like your day-to-day, like the base of who you are feels different. And I hear that from a lot of moms. And I think that's probably one of the most uncomfortable, like, symptoms, and it is a symptom of a perinatal mood and anxiety disorder, that you just do not feel like yourself.
Which is like off-putting, uncomfortable, makes you feel like, what have I done? How long can I sustain this? When will I ever have that feeling of being normal myself again? And so when we talk about getting help from there, like, because it's one thing for me today to feel like kick ass and like, I showered, I got some stuff done this morning, like I could do anything. If I need to advocate for myself, today is a good day to do that. Well, we're asking women to advocate for themselves from a totally different baseline, as Elizabeth just said, from a place of,
they lost their mojo. Like,
right. So that makes it even harder. So for providers, like, we all have to keep in mind that, like, it's very different when we are having our best day ever and then we're out there advocating and asking for what we need. Because that, even on a good day, it's hard to admit that I need help and ask for it. But then on a bad day, it's even more challenging to ask for help and to be specific about what I might need, other than I just don't feel like myself. I don't really know, but whatever it is, I don't have it right this second.
And I think you would agree with me, Kim, that, like, I would encourage you to not only be talking to your friends and checking in with them, and yes, if they just had babies, but even if they have like 3 or 4-year-olds, or I have a 13-year-old, feel free to check in with me. Things are up and down in our house, but I also want to encourage you to really hear what they're saying and say, like, especially if they're really not feeling themselves, if they're really feeling like way more tearful than usual, if they're feeling rage or angry, like really extreme versions of our moods, which contribute to us not feeling like ourselves, right? But things like, if they're having like a extreme version of like worry or concern over their baby, if they don't want to leave the house, if they're really feeling like hopeless, if when you talk to your friends, you're hearing some of these things, really encourage them that like there's treatment, that they're not alone in how they feel, you know, and that we want them to get the proper help. That you know, I think we want to encourage those moms to be telling their OBs to find a counselor or a therapist that can talk to them and get them feeling better. Treatment works, and that's the really cool thing. Yeah. And I really appreciate, you know, before I started working a lot with PMADs, I did most of my work with PTSD. PTSD is very treatable. It's very, very common. And a lot of people don't get treatment for it for a lot of valid reasons, you know, which is unfortunate, but it's very treatable. PMADs, postpartum depression and anxiety, postpartum PTSD, they're all very treatable. And so let's not suffer needlessly. Like if you're really not feeling yourself, something's off, let's get it taken care of. And so if we, you know, and that kind of brings us first full circle. That's why we need to be talking about stuff like, yes, this is a real thing. You don't need to be scared about what's going on. Like, let's tell some people so that we can get you some support. I wish I would have gotten support, or, you know, I wish I would have done something for my really extreme feelings, or I did do something about my really extreme feelings and I felt better, you know, by talking. Does that make sense? So like, if moms were more open about like, because the fact of the matter is, if we had 100 moms here and we said, who's been dealing with PMAD or who's ever had any experience with PMAD, you know, more than the statistics show would end up raising their hand if we all felt safe enough to be honest about it.
Right. That's easy, right? Because most of the time, if we're not feeling safe enough, we're going to say, yeah, I've never experienced that. And then once you feel safe and comfortable, most women will talk about. I mean, there's just so many things here to dive into, and we have a few minutes left. And one of the things I was thinking while you were talking, Elizabeth, is that, you know, so we say this, like, reach out for help, get started. So how do you do that? Like, how do you, when you're experiencing those, and when you talk to a friend who's experiencing these higher levels of, and it doesn't, you don't have to wait till they're higher levels. Please don't wait. If you're experiencing at any level, just reach out for help. But like, where do you start? And so I think that that's important to know. And often, I mean, one of the things I'm obligated to say to moms who call the Moms Line, which is 314-768-MOMS, you know, they'll the first thing I'll say within the first few minutes is, have you talked to your doctor? And so, because I do want to make sure they've talked to a doctor about this. Have you talked to a professional? Do you have a counselor? Do you have a therapist? You know, have you talked to someone? Really glad you're calling for peer support, and let's get you connected to peer support, and here are your options. But have you talked to someone else? And I hear often from moms, how would I get that started? I'm 6 months postpartum. I don't have an appointment with my doctor for a year, my OB, right? Because that's what happens for women. I don't have an internist. I'm 28 years old. I don't have a primary care physician because I haven't needed one. I've seen my OB every year.
Yeah, and that's really common, right? For moms,
right?
Primary care comes from their OB.
If I have insurance, moms will say, I have this list of 300 therapists. How would I get started? What do I do?
Yeah.
Right? So like, there's a lot of support and help out there, but how do you access it? And so, you know, one way is to call your OB, even if you're not scheduled to see them for a year.
Say, who's your go-to for a counselor, for a therapist?
Yeah. And hopefully their office has a list of go-to people. You certainly can call the Moms Line, and we'll talk with you, and we'll share with you who our list of vetted providers are. I'm not going to send you a list because I don't want to overwhelm you. Tell me what insurance you have, and I'll look up who's in what insurance and give you a couple of people. You know, so I think it's key to know that there's multiple ways to reach out for help. And it's okay, and it's one of those things that I think we need to have the expectation, and moms need to know that, hey, there's a really good chance you're going to have to reach out for support several times until you get what's right for you. And I used to find that really frustrating, and I used to like hate to have to say that out loud. And then I think about like trying to find the best orange juice that tastes the best for me. And you know, there's so many options. And the reality is that, yeah, it's taken me a long time, and there's a couple brands that I really like. But it can be frustrating, or it can also be one of those things where, of course, it's going to take a lot to get some help, right? Like, we're going to find fit, just like, you know, I mean, I know I love Granny Smith apples, but I also like a certain type of Granny Smith apple. I like them to be really firm. I mean, I have these things in my head
of preferences.
Yeah. So it's frustrating. It might take several conversations to find the right support and help for you. You know, there's places to start with your OB. If you have a therapist that you used to see 10 years ago, 6 years ago, and maybe, you know, and you stop that relationship because a lot of moms say, well, I had that all handled. Yeah, we did. There are certain times we got stuff handled, and now is a time when we need to get back into support.
But start with a safe person, and that might be a former therapist. It might be your kid's pediatrician. Hell, it might be your pediatrician. All you're doing is, like, from when you were a kid, all you're doing is calling the office and saying, who do you recommend? Right. You know, is just getting those referrals and make the appointment. And it's a brave, courageous thing to do. And we're not saying it's easy. We're just saying it's super, super important. And so for some of, you know, the people that I work with, they just need the appointment made. And like, because I don't know about you, but just the stress that comes with scheduling and organizing everything. Yeah. So maybe they need help from their partner to just be like, here's a list, here's a short list, or here's the recommendations that our doctor made. Will you please just make me an appointment? You know, let's just do the thing, you know.
And a friend can do that.
A friend can do that.
That can be one of those things where the mom is like, I don't know where to get started. I have this list of people. And you could say, hey, do you want me to, what questions do you want to ask them? I can call and get that started.
And any good therapist should talk to you on the phone, tell you how they practice, answer any questions you have. I mean, they're not going to have a therapy session with you over the phone, but you know, if you have questions, if you want to understand like what makes you a good provider for me, you know, ask any potential therapist those questions. I welcome those questions. I want to know what they're thinking and what they need. And, you know, and you know, if you don't get a call back, if you leave a message with a therapist and you don't get a call back within a couple days, like, they're not going to be the therapist for you. Right. And that's okay, you know. But take advantage of the resources that are available. And sometimes it's like, put your insurance to work for you. There are some insurance plans that will find you a therapist and make the appointment. They have like that service available. But get in and think of it like a check-in, just like we get our teeth cleaned every year, and we get our woman's exam every year and a physical every year. Like, if someone isn't asking you specifically, how are you doing emotionally? Get a therapy check-in, you know?
You know, we've got a lot of women who don't have insurance benefits that cover mental health. And so past 6 weeks postpartum. And there is help and support for women who don't have insurance past 6 weeks postpartum for mental health. So there's therapy, there's therapists, there's organizations that provide varying levels of support for free. There's sliding scales, there's for free, there's therapists who take Medicaid. I mean, we have so many options. So if you're feeling like, oh, well, you know, my friend, you know, I know that she doesn't have that kind of coverage through her insurance, so she's not going to be able to get mental health support. If, you know, two organizations come to mind that do a fabulous job with that level, with providing that type of support. One is the St. Louis Crisis Nursery and the Family Empowerment Program. Those are licensed clinical social workers who are therapists, like Elizabeth.
I supervise some of them.
And they,
great.
And the Family Empowerment Program provides multiple services, and one of those services is in-home counseling and parenting support. And so, so important to know that that's an option. The Great Circle Healthy Families Program provides parenting support, and that's free. So those are things that, so it's available. So if transportation is an issue, we've got you covered within home. If you don't have insurance, we've got you covered. And peer support. So I'll go back to the Mom's Line, and the peer support is always free. Now that doesn't take the place of professional support services. We're just a complimentary service.
Something is better than nothing.
So it's a place to get started, and that's our Mom's Line is 314-768-MOMS.
I've made a comment on, I posted it on the comments, the phone number. There's also moms groups through the Mom's Line. There's one at St. Clair Hospital, Kangaroo Kids, Jama Birth Village. Is that the?
Did you say DePaul?
No,
Clair?
DePaul.
So they're out there, those support groups, and again, you don't have to register. You can just show up at a support group or call and get peer support. If you feel like you have a family member, it's still Suicide Awareness Month. We just ended last week was Maternal Suicide Awareness Month or Week, and so if you are experiencing, or you have a friend who's experiencing suicidal thoughts, and you want to get help for them, then there's our suicide prevention lifeline. Locally, we have behavioral health response line. We'll post those in our comments as well. Know the symptoms. So, the symptoms of maternal suicide, when women are feeling like that, we had them posted all last week, and we'll post some of those as well. But it's important to know that, we can just come right out and ask somebody how they're feeling. And when we know that we have a place to get help from, it's easier to do that. So that's part of what Elizabeth and I want to do and continue to do for providers, is that, they don't have to be afraid to ask these questions. So just
we have answers and solutions now.
Exactly. So, there's quick places that they can refer moms to, so they don't have to be the expert. Just like as a friend, you don't have to be an expert in mental health to know that there's the behavioral health response line here in St. Louis. There's the suicide prevention lifeline. That's a national service. There's peer support. There's so many options that avoiding asking the question, there's no need for us to do that anymore, because there's lots of places that you can reach out and find that support. And so
we gave a lot of information this morning. So if you have any questions, feel free to follow up on the comment section here at Heartland PMAD. Make sure that you're liking Heartland PMAD and you share that like with others so we can spread the message. If you have any questions or want to make comments, feel free to reach out to myself or Kim. We're happy to get you connected or answer any questions that you may have. And thanks for spending this morning with us.
Have a great day, everybody.
Take care of yourself.
Bye.